Hi everyone. I have with me Julie Litvak.
Hi.
Welcome.
Thank you.
And before she formally introduces herself, I wanted to explain what the topic of today's conversation is. I've been practicing dermatology for close to 20 years, and dermatology today is not what it used to be when I just graduated my residency program. What we were taught in medical school and in my residency about different skin diseases such as psoriasis, eczema, and acne was strictly limited based on the allopathic approach to medicine. Here's a symptom, here's a solution, and that was that. And recently, there has been a lot of buzz about what is the cause of the disease, in addition to genetic predispositions. What in our environment and what in our life is affecting and is the root cause of various diseases? Why do some people have acne? Why are some people more prone to eczema, hives, and other things? And a big role in this realm is the microbiome, or the different populations of bacteria that we have, both in our skin and in our gut. And for me, my knowledge, short of just reading new articles that are coming out in our literature, is pretty limited. And so I have partnered up with Julie, who can actually dive a lot deeper than I can into the various aspects of our functional and integrative approach as an entire person, and look at more detailed questions. And she will explain herself a little bit further as to actually what things she looks at when she looks at skin. So Julie, can you please introduce yourself to our patients?
Well, hi, I'm Julie. So classically, I've been trained as a physician assistant. I finished schooling for that. I was practicing for about 15 years, but a few years into it, I realized something was missing in the care of patients, and it landed me in this functional medicine space, and specifically something known as root cause medicine, understanding why things are happening, and the skin is no exception to looking for root causes and trying to understand it and look there. And so that journey took me into a lot of different educational realms, and in the process I became a herbalist. I have my master's in herbalism, and now that is the sole focus of what I do, is looking at the whole body, looking at where certain disease states come from, with a particular interest in the skin and understanding root causes from there. And the microbiome is, of course, the hot topic of today. And it is no doubt in my mind that is the first place that most people need to look when understanding chronic disease, when understanding long-term issues that really haven't responded to our conventional approaches.
So I was excited to learn that the microbiome of a person actually starts when they're conceived, when they're inside their mother. Whatever the mom eats and the way she basically behaves during her pregnancy will determine the microbiome of a child. In addition, the mode of delivery will determine further the microbiome, or the bacterial population of a person's skin and their gut. So if you have a C-section, they have found that infants have microbiomes closely related to mom's skin. Or if there's a vaginal delivery, the microbiome changes to more of the flora that's present in the vaginal tract. And it's really fascinating that behavior of a woman early on, when she's pregnant, will actually determine things that will affect the baby later on. And this can pertain to the development of eczema or atopic dermatitis, or even other states of disease. What further interested me in looking at the microbiome is, as you know, Dr. Shapsis and I are not just colleagues. We're husband and wife. He's a gastroenterologist. And so I started reading a lot of articles that talk about the microbiome and its relationship between not just irritable bowel syndromes that pertain to him, but also things that pertain to me, such as acne, rosacea, and psoriasis, and even autoimmune hair loss issues can develop from a dysbiosis or imbalance in the gut microbiome. And up until recently, until I met with Julie and started kind of working with her, I didn't know what is the proper way to test for gut microbiome and look at the species that are present there. So Julie, how can we test and look at the environment that's in our gut?
So we do GI map testing, which is gut testing that gives us a pretty comprehensive analysis of what's happening inside. If you think about the body, right, we know there's tons of organisms that live all over. So when you look at the skin, you know there's a lot of organisms that live that. That's 21% of our microbiome. 29% is in the GI tract, and another 26 in the mouth. And then there's a few other systems that house a smaller percentage. So that's a really large group of organisms that we're not accounting for when we do traditional dermatology, right? We're not looking at that 29% in the gut or in the mouth. So the testing that I would do would actually look at those other colonies. And from what we have now, it's a lot of information. It tells us about not just the disease-causing organisms like pathogens, but it also really dives deep into the good bacteria, because we need that normal flora. We need the good guys that are going to help balance, right? Ultimately, what we're looking for is not just to kill things off. We're looking to restore that balance with the good bacteria versus the opportunistic or, the not so great if they're over colonized.
So how do we actually perform a GI map?
So we're looking at a GI map, and then that's an at-home stool test kit. They give you everything. The kit comes ready for everything, instructions and plates, and you basically give a sample and you send that in, and the company gives you a pre-labeled FedEx that gets shipped right to the lab. The lab does the full analysis, and I get the full report.
So after you get the result, what does the test look like, and what does your explanation look like to our patients?
So it's my favorite part is the GI map interpretation. So we get together, whether virtually or in person, and it's a lot of pages with a lot of information, a lot of organisms on those. You'll get your section of the pathogens or like the disease-causing guys, and then you'll get your commensals, which are the good bacteria. You get a nice section on information about your intestinal health markers, so how your gallbladder is doing, how your pancreas is putting out enzymes, even a little bit about hormones. We'll get to see on the GI map. We review it page by page, and anything that we find abnormal, I explain what it is, what are the implications, and also how to restore the balance that's needed to correct it.
Right, because there are different probiotics that we could actually use to
absolutely
normalize or basically.
And not all probiotics are created equal. So just walking into a pharmacy and grabbing a probiotic off the shelf, it might not be what's required for your flora. There's so much detail because it gives me the specific organisms that are missing, that there's other components that are going to go into restoring that balance. And sometimes it's not the CVS brand probiotic that's really going to help you in the situation. And depending on what organisms we find, there's different cleanses and detox processes that I walk patients through step by step. We have protocols that I put together, and I try to make it as easy and as painless to follow through really cleaning up all the sections and really, again, that balance. We always want that balance. So really coming back to restoring that balance and working with my patients to get there.
This whole idea of hormonal acne, adult acne, and I see plenty of it in my dermatology practice. And we do testing and we look at the testosterone and other androgens that are produced both in the adrenal gland and in the ovaries. And sometimes we find that the levels are actually normal. And we just attribute this adult acne and organ sensitivity to normal levels of hormones. But as you explained to me, we can actually look at things a bit deeper and dive deeper and look at pathways that are not visible in the blood. Can you please tell us about that?
Absolutely. So, the blood and the serum testing, that looks at the actual hormones circulating, but there's so much more that's happening with hormones. And one of the ways that I take a look at that is using the Dutch test. And so the Dutch actually is like dry urine sample, right? So it's also an at-home kit. Patients can take it home, do it at their time. If it's a cycling woman, they'd have to kind of correlate it to their cycle. And what it's looking at is it's looking at hormonal metabolites. And what we can do too is when we're looking at metabolism is actually the pathways of the hormones, right? So a testosterone might look normal on the blood work, but then we'll look at which pathway the body is breaking down the testosterone, and that may look very androgenic, or that pathway is causing that excess hair on the face and hair loss, and acne and sebum production. So that will really look at those specific markers and pathways where the blood just can't do that. We're also looking at, in the blood work, one marker at one time, but hormones fluctuate not just monthly or through the week, but in a daily rhythm. So there's certain times a day that it might be really low or really high, and we're not really catching it with a single blood draw. The Dutch test is a series of 4 or 5 samples. So you're really actually mapping that pattern out. You're actually getting a more realistic picture of what your hormones are doing, which may really look different from the blood.
I tried to do a sample early in the morning on the second day of your period, but I am looking at one blood draw per day. And so it is a much more comprehensive test. There's no doubt about it.
Yeah.
And it also looks at the breakdown.
And it gives you tons of information about even your estrogen metabolism. How are you breaking down and fit? Because estrogen goes through certain phases of breakdowns. There's the first phase, the second phase, the third phase. So that actually gives you that. How are you methylating? And so much information about overall in terms of your hormone panel and your adrenals, because the Dutch test looks at your stress hormones, which can play a huge role in multiple conditions, especially in the skin. So having really high cortisol at night or having really low throughout the day, those are all things that affect the health of a person in multiple ways that we can assess through the Dutch.
And so the other question you may have is, once you have this information, what do you actually do with this?
So one of the things that I look at is, how I can divert pathways or change up certain ways that those hormones, I kind of redirect them. I push them where I want them to go, I guess, and I do it fully naturally. So there's so much research and there's so much information about the efficacy of herbs. And I'm glad that, everybody's kind of catching on to this. But yeah, and just to say this, right? Hormones are, the way I see it, they're always secondary. They're never primary. What does that mean? That means that when the hormones start to go haywire, there's a root cause reason, right? So that's when I still go back to that GI map, because there's something off on why that body's not doing the way it should be doing. Because I think, we were given this body to function, not malfunction. So when it does, we want to understand why. And so I will treat the hormones herbally and naturally. And there's so many different, depending on where I see the problems, there's so many different things that I can do, whether it's a nutraceutical or an herbal, or sometimes just diet modifications can make a huge difference in that pathway. But also I want to understand if there's a lot of things going haywire, why, and how can we address the root cause of it as well, because it'll be a cascading result.
And I love this marriage between traditional medicine and functional and integrative medicine. From my own experience, I was able to test myself and I was found to be lactose intolerant. A breath test showed that I had H. pylori, so that was treated. I avoid dairy products. But in addition to that, right, if there's still bloating, if there's still acne, right, we can look at the gut microbiome, and that shows us the picture of what the bacterial populations look like inside, and then the Dutch test will give us more information about the circulating hormones.
Yeah.
What else can we do in addition to the GI map and the Dutch test to look at our overall health?
2 main things. Number one, I spent a lot of time on a really good history, because often patients have the answers that I'm looking for, and they're going to give me what the issue is in just that history. The second one I also utilize a lot is an oat test. And what that is, it's organic acid testing oats. So organic acids are, it's a complicated test, but just to give like a brief synopsis, it's basically, again, metabolites that come in. So there's a lot of processes in the body where we were beautifully constructed, complicated. And we can find those processes of the body in the urine in like almost their end results. Like after they went through a cycle of things, then we'll see at the end what's coming out in the urine. And that gives us tons of information. So I look at it to understand their nutritional profiles, how the mitochondria is doing, which is the energy house of the cell. So how are they producing energy and restoring their cells? We look at things like, also metabolisms of different organisms that can be harmful, like mold species and fungal species and bacterial species. There's a lot of information. Metabolic disorders, so we can get a great picture of understanding how metabolically fit or unfit the person may be, even without overt symptoms at this time. There's certain signs that we can pick up on. Neurological stuff as well. There's a lot of neurotransmitters that we're excreting in our urine. It's just a piece of the puzzle on what's happening and how we can help to restore.
We used to live in an environment where the heating in our apartment was forced air. I suspect that the cough that one of my family members has now is probably due to the mold that was circulating. So please remind me to do the O testing on that family member.
Yes, that's a great way to start. There's also, aside from those kind of main tests that I do, in some cases, I'll find patients who have really kind of abnormal results in those baseline tests or symptomatology, and we'll go on and do specific mold testing, which is, also there's different ways to do it, but urine is the main way. Sometimes I have to go into environmental toxicology. So there's different things that I can utilize past those tests. And it's a case by case basis. But yeah, mold is a big problem. I haven't been so keen on doing it from the get-go, but I end up doing it quite a bit.
Why is this branch of care kind of omitted from the medical school education and from the major insurance panels, right? Because these tests are not covered by insurance carriers. So why do you think that is? How can we explain that to our patients?
That's a great question. I think that there's been this real focus on the allopathic medicine, right? So disease state treatment, right? And that's kind of been the way conventional medical has been set up. So when you're talking about things that are not a true diagnostic, right? So the GI map, the OAT, the Dutch, all the tests I'm talking about, they don't diagnose a disease.
They look at the root cause,
They look at understanding the body and its processes and what's happening. So I'm not able to tell you based on these tests, you have acne or you have IBD or anything like that, right? But I'm able to understand that the body is out of balance, and that's not a billable diagnosis. And so a lot of states have not been able to, materialize it in a way where they can bill it and they can diagnose it, and so they don't. But there are states that have. So there are states that have been realizing the importance of preventative medicine and functional medicine and root cause approach, because even though there's an upfront cost, there's long-term benefit and money saving when you're not constantly dependent on pharmaceuticals and more testing and more treatments. So there are tons of states that are recognizing it. I hope that New York will come and join that and be able to, understand the benefit of this, but we're not there yet.
The changes I see in the 20 years that I've been in practice are astronomical, and I hope that as time goes on, we will continue to learn this mystery of the human body and what causes disease states, in addition to the Western diet and the stress that we're surrounded by, and the microbiome or the bacterial populations in our body. So it's an open book, and we will continue with excitement to follow what science brings us. Thank you for joining.
I am so excited to join Khrom Wellness with Dr. Khrom. I'm looking forward to helping patients in understanding their bodies, discovering the root causes, and healing.
I'm very, very excited to implement personalized medicine into my practice. In addition to looking at your own overall picture of your body, such as your microbiome, your hormone metabolism, etc., I plan on implementing genetic testing pertaining to you. So we can look at your individual markers and look at how certain people age, how active their collagen breakdown is, how prone are they to sunlight, how prone are they to pigmentation. These are all things we can look at on a genetic level, and personalized medicine is the way of the future. So we will continue to stay on top of research and use it in our practice for our patients.